Ntoburi, and I am one of the 6 certified nurse midwives at Olmsted Medical Center. It is my pleasure to speak with you today about the Certified Nurse Midwifery service at OMC. Our philosophy of care starts with the understanding that pregnancy, labor, and birth are a normal, natural part of life. We partner with you and your family to ensure you have a safe, healthy pregnancy, labor, and birth. Midwife means with woman, and we strive to be with birthing people and their families in order to facilitate a safe arrival of baby. The midwife service at OMC cares for healthy, low-risk pregnant people and also cares for non-pregnant people who have a uterus. And we can care for you throughout your life. We have a beautiful birth center at the Women's Health Pavilion where you are able to labor, deliver, and have your postpartum stay in the same room. We do have 2 designated water birth rooms and can provide that service to people who qualify. We are experts in guiding people through active labor and supporting those who would like to avoid the use of medications during labor. We support physiologic birth, allowing freedom of movement during labor, encourage eating and drinking, and provide intermittent fetal heart rate monitoring. We have aromatherapy, birthing balls, deep soaking tubs for hydrotherapy, and all of the labor, delivery, recovery, postpartum rooms. We can provide a calm atmosphere with the music of your choosing throughout the speakers in the room and the bathroom, if you so desire. If the laboring process becomes long, or if you are planning on using pain relief measures during labor, we offer nitrous oxide, fentanyl injection, and epidural. Nitrous oxide is a blend of nitrous oxide gas and oxygen in a 50-50 mix. It can provide some relaxation and help with deep breathing during contractions. The medicine is removed from your body when you exhale and seems to have little effect on the baby. Fentanyl is an opioid pain reliever. It tends to make people sleepy and will last about 1 to 2 hours. It can cause the baby to sleep or relax as well. Epidural anesthesia is provided by an anesthesiologist who usually is able to arrive in about a half an hour from the time it is requested, barring any unforeseen emergency happening elsewhere in the hospital. This medication causes you to feel numb to pain sensation from your upper abdomen to your toes, although it does not relieve the pressure sensation, which is helpful when the time comes to push the baby out. It will take about 2 hours for the medication to wear off after the baby is born, so you will not be able to get out of bed immediately after the birth. The Certified Nurse Midwife service at Olmsted Medical Center has a very low cesarean section rate, 7.5% in 2021. A total of 5 episiotomies were done on our patients in 2021, usually to facilitate a quick birth due to low heart tones in the baby right before being born. We cared for 330 patients in 2021. As you may have guessed, COVID-19 has affected patient care in the hospital. Currently, there are 2 visitors allowed, no visitors under age 12, and surgical masks are required in the hospital and clinic. We continue to welcome doulas if you plan on having one present with you during labor. You can expect a labor nurse, a charge nurse, and a midwife to be present at your birth. We ask for other assistance as is required for the care we need to provide for you following birth. We have an emergency button we can press if necessary, but if all goes as expected, there will be 2 nurses and the midwife in attendance at your birth. We do have a midwifery student with us throughout the year, so she may be present as well. You will have met her during the course of your care in the clinic setting during routine prenatal appointments. We have begun offering telephone visits during prenatal care due to the pandemic as well. If you would rather meet by phone, there are designated appointments where this can be available to you if you choose. We continue to recommend and encourage everyone, including pregnant people, to receive the COVID-19 vaccines and booster doses to protect you, your growing baby, and those around you and your healthcare providers. We are screening everyone at 38 to 39 weeks for asymptomatic infection in order to have protections in place during hospitalization should labor occur during this time. We would love to continue to provide care to you following pregnancy by seeing you on a yearly basis for your routine care. We can counsel on contraception or birth control, place birth control devices, treat you for urinary tract infection or vaginal infection, and help with other menstrual or reproductive issues. Thank you for your interest in the Certified Nurse Midwife service at Olmsted Medical Center.